Hello, everyone. Welcome back to Behind the Scenes in Health with Dr. Ron podcast, the show where we sort of explore the bold journey of healthcare professionals who are redefining impact beyond the clinic. And in today's episode, I'm joined by Dr. Clifford Enobun. I hope I got that right. A
Yeah.
dual licensed medical doctor, and he's also a senior public health practitioner at Southampton City Council. He has nearly a decade of experience spanning across Nigeria and the UK, where he's led different transformational public health programs that look at health inequalities and empower communities. He also looks at wider determinants of health to driving real systems change at systems level. So this conversation is going to be packed with a lot of insights and hard-earned wisdom from Dr. Clifford himself. So whether you're considering a transition into public health or you're simply just curious about how real change happens behind the scenes, this episode is for you. So you would just want to stick around to the end. So Dr. Clifford, thank you so much for honoring our invitation to this episode.
Thank you very much for having me. It's such a pleasure to be here. Thank you so much.
All right, let's dive into the conversation. So typically, I usually like starting from the beginning, right, where it all started from. So looking at
Yeah.
your journey till now, can you sort of take us back to the beginning? What sort of inspired you to pursue medicine, and how did that journey evolve into public health?
Okay, so for me, so how did I get into medicine? I grew up. I remember that. So I have uncles and aunties that are doctors and nurses, and I grew up in Ibadan. So I was born and bred in
Okay.
Ibadan in Nigeria, and I went a lot when I was small. I went a lot to UCH just to see my auntie, my uncle. They always come around for exams.
Yeah.
There's always so I've always been in that space of medicine, and I remember that when it was time to, so from secondary school, I always said, sometime I might be a doctor. I remember I was still considering I wanted to study mathematics in school, in the university, because I loved maths. Then also I wanted to do pharmacy. It was quite a lot of things I wanted to do. But eventually, somehow, when it was time to fill the JAM form, I
Yeah.
filled medicine but I think the influence of that young influence of seeing doctors in white coats, seeing people running
Yeah.
around in UCH, I think it just stayed ingrained in my head, at the back of my mind. So I was like, okay, eventually when it was time to make that decision, I eventually went for medicine, and it was wonderful. I studied at the University of Ibadan. That's College of Medicine, University of Ibadan. During that period, I'd always loved public health. So I told myself at some point, maybe when I'm in my 50s, 60s, I'll do masters in public health, get into public health space, and
Yeah.
that was like my retirement plan. Public health was my retirement plan. So finished school. Usually in College of Medicine Ibadan, we do some postings in community medicine, public health. There's a place where we go to Igbora. So we have like a community outreach where we spend a couple of weeks just to embed in the community and see, do we do a project there? That's our public health, posting and a project.
Yeah.
Do a research, we'll do all the whole release the paper and all. So we did all of that, and we finished school. And I just entered into the private space, private industry, medical industry. So I worked in quite a number of private institutions. I worked in Ibadan, then I moved over to Lagos, and I worked at Duchess International Hospital for a couple of
Oh,
months.
awesome.
So it was at that point, and now, so let me backtrack a little. At that time, I'd already thinking about moving to the UK. Most medical doctors by the time you're leaving
Jackpot.
school, yeah, jackpot and all of that. So I was like, okay, I wanted to move to the UK, but I wasn't very sure about it. But I knew, okay, I needed to write my exams, my PLAB 1, my PLAB 2, and all of that. But I wasn't getting dates in Nigeria, so I was like, what will I do? So I just said, okay, why don't I just kill two birds with one stone? Let me move to the UK, do my masters in public health. So I brought forward my retirement plan of doing my masters in 50s and 60s, brought it earlier. So I said, okay, let me go to the UK because I got a date to do in the UK. So I was like, okay, when I come to the UK, do my masters, I would write my PLAB 1,
Yeah.
my PLAB 2, then I would move into emergency medicine because that's what at the time I left school, I was like, oh, I want to do emergency medicine. I really wanted to do emergency medicine. And so I got into the UK. I did my master's at the University of York. So I did my MP. Along the line, I don't know what, I think I was just sold out. And it just sweet in my head, like, oh, why really do I want to do emergency medicine when I can start public health now? and enjoy this work-life balance till old age instead of laboring. No offense to people doing emergency medicine, no offense, but instead of doing emergency medicine and being in the hospital and clinic for hours, and I said, "Bah, maybe just do my." So at that point, doing my master's, interestingly, I did my PLAB 1, PLAB 2, like within 6 months of each other. I just did it during my master's. So
Wow.
I got licensed. I have my GNC license in the UK to
Okay.
practice. So like, but even though I'd finished it and I got the license, I was like, no, this master's in public health, this public health is where I've come to love, and I'm staying there. So after doing my master's in public health, I got a job in a local authority. That's it. So I've been in public health ever since then, enjoying it, loving it.
So does this mean you're not going back
Going back
to
to
the
what?
emergency medicine? Emergency
Okay,
medicine.
so interestingly, there is an emergency aspect of public health. So emergency preparedness, pandemic control, health protection. So there's some sort of
Yeah.
emergency response in public health. And I think that's what really
Mhm.
sold me out, because by the time I got to understand the length and breadth of public health, there is a space for everybody. That's a good thing.
Yeah.
So you can bring in your skills in the emergency, because if quote unquote there's a pandemic, or there is maybe like a flood outbreak, or flood
Yeah.
or disease outbreak or whatever, what kind of um, adversity, is that adversity I'll call it now, or tragedy or anything that happens environmental, you would need that kind of clinical, expertise to also to balance your public health approach. So in public health, there's really a space for everyone, and that's it. So for me, I'm not going back into the clinic again. I'm staying here. So however I want to merge public health and emergency medicine, it's left for me to explore in the coming years.
That's really interesting, really, because I mean, I speak to a lot of people, and it's always fun and insightful hearing the different triggers or why people sort of shifted into what they are doing now outside
Yeah,
of clinical medicine. So, looking at
yeah,
your transition now from clinical medicine in Nigeria to doing public health work in the UK, what was
yeah.
that journey from? Because I know it's not without its own unique peculiarities or challenges. So,
Yeah.
what were the issues you sort of faced, and how did you navigate those issues?
I think, I'm very active on social media, and I see quite lot of people still talk about, oh, public health, masters in public health is a waste, and why I acknowledge the fact
I'm
that I've
gonna
had,
even bring that up later. Yep.
yeah, why I've had, I'm always I'm very careful. Also, I'm a big proponent of of the public health space.
Yeah.
It's the UK public health space is very different from Nigeria. In Nigeria, you just need to have the masters in public health, and that opens the door for you. Actually, it's like your qualifying rights into the public health space
Hmm.
once you have a master's, or once you have a master's in epidemiology. It just opens up that door for you into that space. You can work anywhere. But in the UK, it's quite very different. And I recognize my privilege, and recognize the fact that very early, once I started the masters and I started, thinking about, I think it's time for me to make that switch. I had quite a number of mentors and people that I could seek counsel from.
Okay.
One of them, interestingly, is a Nigerian that worked in Ibadan, in the University of College of Medicine, an Institute of Child Health. It's one of the like foremost adolescent health specialists in Nigeria. And he transitioned into from public health into the World Bank. He works in the World Bank now, interestingly, as a public health
Very nice.
specialist. So when I had the conversations with him, I had also met a couple of people, in the UK, and I spoke with them, and at that point, they told me, "Could this is what you would need? Masters in public health is very good. It's absolutely amazing, but it's very theoretical, and
Yeah.
that doesn't really translate to experience in the UK." So they told me right from the very start, you need to emphasize, there's a big emphasis on experience, skills, experience, and competencies more than just the qualification of the masters in public health. So I knew that quite very early. So while I was doing my masters, I started looking out for places for me to gain that experience.
Experience.
Yeah, I started doing, applying to different places, even with my master's. But even during the time I was doing my master's, but I kept getting a lot of unfortunately. And whenever I ask for feedback, they'll say, "Oh, you have this range of experience from Nigeria. You're a doctor. You've done some public health. You worked in the public health space. Especially because so to go back, even while I was in Nigeria, during the time I was working in the private institution, I worked with some NGOs, with regards to maternal and child health, public health also. So I've had some experience with public health.
Yeah.
So, but the feedback I kept getting was, you don't have the UK experience. So the question was, how do I get that UK experience? Because that was going to be like a determining factor in interviews. So I learned how to shoot my shots at places in the UK just to have that work experience. So I had like volunteer experience, exposure, just to have that under my belt. And it was really good for me because while I was in the University of York doing my master's, the
Mm-hmm.
not so there's one of the because I lived in New York, and there's one of the councils around, the North Yorkshire Council. I just wrote a cold email to, I got the consultant and the director of public health email from LinkedIn, or I think from Google. It's always, everything's always online. And
Yeah.
I just sent a cold email to them saying, "Oh, I'm a doctor from Nigeria, currently doing a master's of public health, but I really want to understand how public health is in the UK, and I feel like having this unpaid, volunteer work experience, just having this placement with you would do a good,
Yeah.
would do me well in helping me understanding this UK, landscape, and also for me to contribute to the work you're doing." I did like a really sent my CV, wrote a supporting statement just to show that I really want to have this.
Wow.
So I got a response from them, and they gave me an opportunity to come, do a work experience with them. So that itself set me on a very, it made my application quite very, very attractive.
Mm-hmm.
But when I had to apply for other jobs, after that, I could really speak the language, because if you don't
And you've
have
done
that,
something.
yeah, because I'd done something, because I'd seen something, because I've experienced something, I could pick some of the languages I've heard in those meetings, the one-to-ones I had, to include in my supporting statement to show some level of that understanding of the UK space. And I'm sure it's the same thing, even if you're working in the NHS, there's always that thing about understanding how the NHS works. So it's the same thing in public
Absolutely.
health. In public health, what exactly, how, do you speak the language of public health in the UK? Because it's very different. I'd worked, I'd seen how it is in Nigeria and in the UK, they're quite very different. So because I had that exposure, it was easy for me to evidence it. So it took, I'm not going to lie, I had quite a number of unfortunities, but because I'd done that work of going for that work experience, the volunteer space, that opportunity, it really helped me to evidence competency and experience at interviews and in the application stage. So that's how it's been so far.
Interesting, because I mean, looking back at that, like you said, I think a couple of days ago, people were just lashing out on Twitter or X that a master's in public health in the UK is a waste of time, is a waste of money, because basically you wouldn't get a job. And I think I counter one of them. I was like, but I know a lot of people who have done MPH and they
Yes.
are actually doing good stuff.
Yeah.
So, like you said, probably is the approach to how
Very
we are
much.
sort of doing stuff. Like you just clearly said, now you sent cold emails, you just to say you need that UK work experience. So even in my space too, everybody's looking for UK work experience. So
Very
one way
much.
or the other, you just have to find a way to get it, even if
Yes.
it's through volunteering,
Yeah.
placement. You just have to
Yeah.
find it. And
Find
like
it.
you said, the language here is also sort of different.
Mm-hmm.
Like I work in the project management space in the NHS too, so it's also a different language from
Yeah.
what we are doing in Nigeria and all of that.
Yeah.
So I think that's a really good point. So for anybody watching, I think it's you're interested in public health. This is a very key point to note. And looking at again, still on your transition, right?
Yeah.
Now you work as a clinician in Nigeria, moved over here, and you're now in the public health space. What aspects of your clinical background or what skills would you say that proven really valuable in your
Mm.
work in the public health space?
So I think for me is all as a clinician really, it lays the right foundation for any other space you want to move into, and that's the honest truth. If as long as you're a doctor and you applied yourself, while in school or even while
Yeah,
you're working, you have all, because especially public health draws skills from other things. So it's not public, apart from the core public health technical skills that you really need to have, many of the other skills are skills that you would use in any other profession. So when it comes to communication skills, we call them the soft transferable skills, or communication skills,
yeah,
presentation skills, teamwork. They are all skills that you really need to have, as if you're a clinician or you're in any other profession. Having those skills as a clinician really helped me, because if you're a doctor, you need to speak with people. You need to know how to speak with people. You need to know how to carry people along in a presentation. You need to know how to engage with, of course, you don't do a lot of community engagement as doctors, as clinicians, but you do a lot of patient, relation,
Yeah.
that's engagement. So you really need to how to speak with people. You need to how to get people's buying in. So that's what you can transfer into, stakeholder engagement, community engagement skills. You need to have all of those skills really. There are quite a number of skills really that one would, if you think about any skill you use in any other profession or even as a clinician, maybe not core clinical skills like,
Yeah.
diagnosing illnesses. You really don't have to, that we really don't do that. But of course, in public health, your understanding of how infection, especially infectious diseases, how they, carry out all these pathogens and all of that, there are things you would also move, you can carry along into public health as a clinician. But every other skill that is public health is something that you eventually would learn, and skills that they are very public health skills like commissioning, procurement, how to do a needs
Mm-hmm.
assessment, how to do a service review, policy, how to write briefing papers, how to, what are the steps involved in policies. There are things that eventually you would learn on the job, or you
Yeah.
have the exposure. But every other skills are skills you would learn, you can bring in from any other profession.
I mean, thanks for sort of emphasizing on this point, really, because that's one of the sort of key things, or, I hear from people. Okay, I've worked as a doctor all my life and I'm trying to get into this space. I'm not sure I can fit in,
Mm.
right? Forgetting that, like you said, transferable skills
Yeah.
from the hospital, communication,
Hmm.
teamwork, collaboration.
Yeah.
And some people, I'm like, well, if you break it down logically, if you talk about teamwork, doctors don't work in isolation. You work with
Exactly.
consultants, you work
Exactly.
with nurses, you work with
Hmm.
everybody.
Yeah.
So that's like a good,
Hmm.
example to talk about teamwork and collaboration.
Very much.
Or you talk about presentation skills. I think I was speaking to somebody the other day. I'm like, we do mortality reviews, so we do grand
Word rounds.
rounds where
Exactly.
exactly somebody is asked to come and present. So, and before that presentation, you have to prepare yourself, gather all your data
Exactly.
information. Then you come
Exactly.
and sit in front of the whole, do your
Hmm.
presentation, answer
Hmm.
all the questions.
Hmm.
That's presentation for whether you like it or not.
Yeah.
So I think when they look at it like this, it starts to become clear
Clear.
that we actually have a lot of these skills that we can move over. So
Hmm.
looking back, is there anything you sort of wish you would have done differently during this your transition period from clinic to public health?
Done better.
Yeah, or differently.
Differently. Honestly, when I think about things, this question, I don't think I could have done anything better. And yes, there's always
Okay.
space, there's always an opportunity to do things better, but I feel like because, I came into this space, as things unfolded for me and as my career path got clearer for me, you know, I'm taking
Yeah.
the lessons that I'm learning. I'm understanding the parts more and more. So I'm not necessarily that I had any expectations. Maybe the only expectation I had for
Yeah.
myself is, of course, I want to get to the very peak of my career as a consultant. I want to be able to be an authority in public health space. And I look at myself. I came to the UK less than 3 years ago, and now I'm one step away from being a consultant in that sense. I
In that
yeah,
space,
in
yeah.
that space. So I feel like eventually the lessons you learn would help you. And if you're paying attention to the lessons, and you're not taking the hardship or your journey, you're not taking it as, maybe you're not taking it on face value, or you're not repulsive to them. Understanding that your journey is your journey, you would have to, go through maneuver different things to get to where, as long as you put your focus on the goal. So I really don't have any maybe lessons or things I should have done better, because I feel like I have more opportunities, even if I haven't done anything better, which I can't think of not doing anything better. But I don't think that
Yeah.
there's anything that I have done or I'm going to do that I cannot, I will not have an opportunity to do it better in the future. So it's just having that open mind, just be very open minded and be very flexible. Maybe if there's one advice I'll give to anyone is to be very flexible. Don't be too stuck up in, especially coming into public health. I've I've come to realize a lot of things more in public health. Like I said, I recognize my privilege, in that I'm able to move in very fast in my career in the UK. It might not be the same thing for somebody else, but understanding how to enter and how to navigate is very important. So there are different roles available in public health, but quite a lot of people don't understand those things. So that's what I really try to explain to people when I tell people, oh, they want to come into my kind of role. Like, it's possible. Never say never. There's nothing impossible. It might just be
Yeah.
very hard, but it's impossible. It's not impossible. So, but you need to understand that you have to be flexible. You might have to take the low hanging fruits roles
First.
first before you rise. And usually, once you prove yourself in the UK, yeah, in those smaller roles, you find out that your rise is very fast because they recognize the fact that you're a brilliant person. You can do this thing. You can get the job done. The opportunities will open up for you. So just be very flexible in public health.
I think one of the key things there is, those low hanging fruits, really,
Yeah,
because I think a lot of people come in with the expectation, okay, well, I was at the top where I was coming from.
yeah,
Expect to operate at that same level in this system. I'm like, no, it doesn't really work that way.
yeah,
Because I remember myself, I had to also start from the low hanging fruits. Once you sort of, prove yourself, show your competence and all of that, then it becomes easier to sort of begin to move up those
yeah,
steps gradually.
yeah.
So, looking at your job as a senior public health practitioner, even myself, I don't know what you do. So, what does a typical day or work week look for like you? Because I'm curious and I'm sure that people are curious.
Okay, so as a senior public health practitioner, I'm in the public health space, first of all. So let me clarify. Let me backtrack a little. I think I can use this opportunity as a learning, as a teaching opportunity, especially for people coming to public health space. So public health in the UK is
Yeah.
it's special in the sense that it was formerly in the NHS, but by 2012 it moved over to the local authority. So the bulk of public health commissioning. So what I mean commissioning is you you commission, I don't want to use the word again, you design or you delegate a set of people to do something on your behalf. That's commissioning, really. The bulk of the commissioning
Okay.
of all the different things with public health now rests with the local authority. There are three main domains of public health. So we have healthcare, public health, health protection, and health improvement. The bulk of health improvement lies with local authority. The bulk of health protection lies with the United Kingdom Health Security Agency, UKHSA, and healthcare, public health sits majorly with the NHS, but the three have the crossovers. So I work with the local authority in, as majorly, and my work stream is majorly in health improvement. And as a senior public health practitioner in the local authority, I work with, or my total, the area in which I work is the wider determinant of health. So everything that has to do with socio-economic, commercial, political, every other aspect of health that influences health, but it's not health. So that means things like health inequalities, like the job, employment, labor, and now commercial determinants of health like tobacco, alcohol, drugs, and gambling. So more specifically in my role, I lead on the commercial determinants of health, that is gambling. So anything that has to do with, because we know that, gambling, like every other behavioral, met health part of, the behavioral side of health has its own related harm on people, on population.
Yeah.
So I'm working in my council at the moment to, we have some recommendations from a scrutiny report from gambling that was done a couple of months ago, and we are processing how do we ensure that we prevent people from being harmed by gambling? How do we reduce the burden of gambling in Southampton? How do we prevent children and young people from picking up the habits of gambling that will become, because it affects everything eventually. People, the money that you're supposed to use
Yeah.
for feeding, for your health, for your, for accommodation, for housing, you're spending it on gambling and you're losing it. And because it's an addiction, or it's in that behavioral science part of public health, you keep wanting to do it over and over, hoping that you get the big payout one day, and eventually it might never come. And because it becomes a big problem. It affects quality of life, family, friends, and all of that. So that's what I'm working on. Then I'm also working on work and health. That's another work stream that's I'm also working on. Work and health, what it means is that we understand that work in itself has an impact on health. And and there are different strategies by the national government and the local government, really. The national government is this: get Britain working, keep Britain working. How do we get people from being economically inactive to becoming active, to be in paid employment, good paid employment? And how do we keep people that are in employment? How do you keep them in employment? So we're trying to keep people in employment and good health. How do we ensure that people that have, because one of the things about public health is we're trying to reduce health inequalities. And that's why we have like the Equality Act of 2010. The Equality Act of 2010 is says that there are some protected characteristics that must be protected. They must be given because of the fact that they have a level of barrier to accessing health. They must be given equitable access. So there must be reasonable adjustments to them, to their circumstances, to get employment and also to keep them in employment. We also understand that there's some people, inclusion health groups, like people from ethnic minority communities, people from, people that are homeless, just ensuring that people can stay in employment really, regardless of what their status is in the country. So that's what I work on. So on my typical day is, and the good thing about public health, let me just chip this in, is I don't have to go into the office every day. So
Awesome.
the bulk of my work is hybrid. So maybe once or twice in a week, I go into the office for relevant, important meetings. Most of your meetings will be online. So that's a good thing. So I'm selling public health to everybody. Public health is one of the few roles in health that you can work from your home. So except if I have like an important, maybe stakeholders engagement meeting or community engagement meeting that I have to go into the office, or maybe any team development meeting. Most of the time I'm in my house. I work from home. So my typical day is starting your day and organizing your meetings on Teams, you're scheduling all your meetings you have. And I do a lot of things because most of my work is a lot of cerebral work, not necessarily physical work. I block a lot of time out for thinking, for creative thinking, ruminating to do the work, I'm doing. So that's it's never the same thing every day. It's very different. So one day it's all meetings, another day it's all free. Just have my time to myself to think and write, maybe have papers to, submit and evidence. And some other days
Yeah.
I might not have to start work by 8. I might start work by 12 because I choosing to do a flexi day. So that's the thing about public health, really. Really.
So you're selling public
I'm
health to
studying
us now. We
public
should
health.
come
It's one of the
over.
few professions in health where your weekend is your own. You don't have to do anything on Friday, on Saturday, Sunday. So that's it. That's my typical day, really.
And you enjoy the bank holidays
You
too.
do enjoy your bank holidays, honestly. You don't have to go for any shifts. Your day is your day, really. So that's it.
So just curious again,
Yeah.
so looking at what you do, is there some bit of field work involved, like going into the communities, trying to gather evidence or data to support different initiatives you might be working on?
So it depends on what you're working on. I remember because before I came into Southampton City Council as a public health, I used to work with Stockton on Borough Council as a public health practitioner.
Okay.
And that I led on migrant health, inclusion health. So I did a lot of going. So the field work we had to do was, going into the communities, different. And the thing about public health, communities is divided into two. So it's either a geographical community, that's a space where people are together in a particular space, or a demographical community. Most of the time, we had to go to places where people are, where we needed to engage with people, do like focus group, do like, have sessions with them. So that really is our
Yeah.
kind of um, field work
Field work.
in public health. But it varies because, it depends on what area of public health you're working in. If you are, I'm trying to think now, apart from people that have to, maybe, except if you're in public health research. So if you have to do a lot of my qualitative research, maybe meet people to get that, qualitative, or, you might have to
Yeah.
really go out to different places. So it depends on where exactly you're working in. And public health is quite very broad and literally very broad. So you can have people working in public health nutrition. We have people working in public health research. We have people working in health protection, vaccinations, go for vaccination drives and to ensure young people, elderly people in the community are vaccinated. So it depends on where you are really. For me, maybe now I'm in much more senior role and I don't have to do a lot of going into the community. And that's, I would go into the community when it's necessary, but I do a lot of strategic policy, leadership. That's more of the role I'm in now. But while I was in Stockton on Borough Council, I did a lot of going into the community. It was almost like every other week I had to go meet people, engage with people, get the feels of what people felt about interventions and policies we were making. But right now I'm doing more of policy, strategic leadership, and all of that. So it's different.
So talking about strategic leadership, right? Are there any, because I know you just didn't land into this role.
Yeah,
So how did you sort of develop yourself to be able to fulfill this role?
yeah,
Because I know the expectations at your level is significantly different from like a junior health practitioner or
yeah,
something.
yeah, yeah. And I hold my current position and my ascent into this space to my previous line manager. in where I was. I think, when you have a line manager who is secure in him or herself and is very intentional about your growth, the person pays more attention to
Yeah.
recognizing your skills and the person can foresee where you can get to and can help you get to those places.
Mm-hmm.
So I think for me, like I said, I hold my current accent to my previous line manager. Because she was at the level of as a strategic leader, as a manager, but she really recognized my talents and my prospects. So as even when I was a just a public health practitioner, she allowed me to lead on projects. So I did a lot of project management at that
Okay.
level. Even though it was a junior level, I didn't have to, but I did a lot of project management. I did a lot of, in some way, she allowed me to do a lot of strategic leadership, influencing. And then because of that, it was easy for me. So when it was time to get this role, it was easy for me to evidence all these competencies. So I would say
Yeah.
usually but like not everybody is very opportune to be in that space where you have a very supportive line manager. So that what it means, it's going to be the onus will fall on you to really create spaces as much as you're allowed to. I know it's very hard to be able to have those competencies. One of the things I would really suggest to people is, where do you want to get to in the next 2, 3, 4, 5 years? What's the next cadre of role you want to get to? Now look at the job description of that role. See how you can get experiences that would evidence those things. I don't know if this is very clear, but
Mm.
if you want to be
Yeah.
maybe a senior public health practitioner or a public health principal, because those are very much senior roles. What I'll tell people is, look at the job description in that role you want to get to in the next 2, 3 years. See how does it differ from your current job description. The places where you see that there's not in your current job description, pick those things out and create the avenue for you to function in it in where you are. Of course, with the permission of your manager, you have the support of your colleagues, because it might mean you encroaching into other people's work stream. They say
Yeah.
if you have if and I think having a supportive line manager is just is the magic, really, because that way your manager can
Makes a
it
lot of
makes a lot of
difference.
difference, because you don't have to step on people's toes, you don't have to encroach on people's work stream, but your manager can see an avenue, an opportunity for you to improve yourself or for you to grow into it and give you so that you are prepared going into those senior roles. So that's how I was able to get into this role, because I was able to start doing many of these senior roles and job description in my previous role. So that made it easy for me, really.
Then, apart from your
Yeah.
MPH in public health, were there any other maybe courses or certifications that you sort of had to do to buffer up your portfolio
No, I
through?
didn't have to. So far. In fact, I've been telling myself I think I need to do this and this and this, but really it hasn't stopped me, because something in public health, which I don't know how it operates in any other place, but especially in the UK, there is a demand for the on-the-job learning. So there's a lot of CPDs you have to do. So you don't have to really take time out to say you want to do
Okay.
some courses that will take you out of work entirely, because you can learn on the job. There's an opportunity for you to learn on the job. And in fact, I would tell you for a fact that when you go for interviews, there is so much emphasis on the job learning and what you've reflected learning and what you've
Learning.
been able to achieve on the job, than really your courses that you've done separately. Because the courses are just courses. You still have to prove that you know what you've learned from those courses. So if you've learned a lot of things on the job,
Yeah.
yeah, if you've learned a lot, what you just need, in fact, I dare say you don't need a master's in public health to work in public health in the UK, but it's an added advantage because you have the rigor of how to do research. Because everything in public health is evidence based. So you know how to get the evidence base for what you're doing. You know
Yeah.
the evidence base of what you're doing. Why? So you know the why of you're not just doing it for doing sake. You know it. You understand why.
Take.
So that's why a master's in public health is good, but it's not the only criteria. And that's why you don't need any other quote unquote courses to be done. You just need to be on the job, do the job, learn on the job, reflect on the job, take the necessary CPDs you need to take. And that already it's enough for you.
Interesting. So I think this quite differs from other
Yeah.
areas where you have to do a lot of
No.
certifications. But again, like you mentioned earlier on, I think there's a big emphasis on what you can do
Yes.
actually on the job rather than focusing on the
Let me
certifications.
put it, but let me. I also want to put this question. at some levels in public health, especially at the very senior levels,
Yeah.
having an added advantage like a master's, like a PhD, doing some other courses might now be a determining factor. But I know a lot of my or the audience in this call are
Okay.
people trying to, enter into public health or into the mid-level public health. At this stage, you need your
Yeah.
experience because eventually, when you get to the very much senior roles, you can now then do if you don't have a master's, you can do a PhD, you can do a PMP, project management, just to be able to move horizontally at that very high level, into other spaces. So it's not that you don't need it, but the emphasis at your stage of public health might differ. You might not need that emphasis now, or maybe later on. Eventually, you do it. Yeah.
Now, okay. So let's look at the wider determinants of health because you mentioned that a
Yeah.
couple of times, when we were starting, right? So for people who are sort of unfamiliar with this
Yeah.
term, what does it actually mean?
So, wider determinants of health, I previously, previously said there are the things that affect health, but they're not necessarily health things. So, things like housing, things like employment, things like socioeconomic status, things like the commercial determinants of health, like the industry players in tobacco, in alcohol, substances, gambling, ultra processed foods. Those are all things that one way or the other affect health because you're not, as a person, you're not living in the space. You're living on Earth in a world where there are a lot of interference of even physical environments, green spaces, natural builds, pollution. Those are things that all encompass as a person. They all affect you as a person, you
Yeah.
know, even family dynamics, social connections you have. Those are things that make you into a person. You're not isolated as a person. You live in a space where different things are interacting together. So those are the things we call the wider determinants of health. And interestingly, I remember I had a chief executive in Stockton Borough Council who always says, I don't know why we call them wider determinants of health, because in a sense, they are really the determinants of health. They're not wider, they are really the determinants of health. Honestly, and I totally agree with that, that line of thinking because really, when you call something wider determinants of it, you make it look like, oh, there are things outside, they are way beyond your control, they affect you from a distance. There are things that, as a person, the kind of family you have
Direct
directly
impact.
impact like the areas, there's something that was released, there was a document released by the is it the King Fund or the Health Fund, which says that places. So let me backtrack a little. The Office of National Statistics and OED, ONS and OED, they have this stuff where they distribute different areas in the UK into what they call areas of deprivation. So there are some places that are more deprived than the
Okay.
than the rest. So conventionally, we say the northern part of the United Kingdom of England is more deprived than the southern part. So the southern part is much more affluent. But even in the place where there's affluence, there are also pockets of deprivation. So there's this research that has been done and said even as in the UK, if you're born in areas of deprivation, your quality of life and even the extent of your life or how healthy your life years and even the healthy life years is reduced. So maybe in the UK, I can't remember before I quote it wrong, but I think life expectancy in the UK is about 75, 80 or so. There's some places that have as much as 85. There's some places that have as low as 60 something. Even in the UK, and that's because where you're born affects your life expectancy in that sense. So that's what we call the wider determinants of health. Things that really affect your health, but they're not really health things.
So in your experience now, looking at because you're sort of now involved in like strategies and policies and all of that, which of these wider determinants are maybe like most often overlooked when people are designing some of these strategies?
So, because my role is currently in commercial determinant, that's also part of the wider determinant thing. So, I wrote a couple of days. I wrote something on social media. I said there are two things that we public health professionals are not looking at very much, and they have so much influence on the health. I think politics in itself is a big determinant on health. Secondly, at the commercial determinant, when I mean the commercial determinant, I'm talking about the industry players. So people that produce tobacco, alcohol, drugs, illicit drugs, gambling companies, they have so much power and they do really affect people's health in ways that even people don't realize. I really maybe cannot
Mhm.
go into that much details with regards to that, but you know,
Yeah.
but in my opinion, I think political determinants of health. politics and the commercial determinants have much more influence than a lot of things than we have acknowledged so far. I'm hoping that in the next few years and decade, we get to see, we should, I hope we are very much prepared for how much politics and the commercial determinants of health will have on health in general. Because, when I, as at the level I'm in, when I see things, I'm like, I don't think we're very ready. We've started seeing how this already plays out in some countries. I will not mention the name, but we already see how this already operates. Yeah, we already see how this already operates, where long held proven research and evidence is being disapproved and cancelled by the political class. And that is very disheartening as a public health. One of what, I'm not mentioning the country, but one of the things I'm very much, is vaccination. I've seen people come up, even in senior, in governance, in government, in politics, where people come out to say
Yeah.
vaccinations is a no-no. And I'm like, the only reason why population has existed to this point is because we've had a lot of wins with vaccination. So for somebody or for a group of people to come
Yeah.
out and say vaccination is a no-no, or some types of vaccines are no-no, it's very scary of what the future is. So just to conclude that in my statement, I think politics and commercial determinants are very much, they're the big deals.
So correct me if I'm wrong, right? So these wider determinants of health, they play a very key role in health inequalities and
Very much,
equity, right?
very much. They do play a lot,
So
yeah.
how, okay, so how can local authorities be sort of more intentional in reducing health inequalities? Because I know, I mean, I try to keep abreast of things happening. So it's constantly being talked
Yeah,
about health inequalities,
yeah.
and all of that. So how do you think local authorities could reduce health
I think
inequalities?
one of the things is recognizing the inequalities, because you really cannot tackle an inequality that you don't know exists. So you need to, I think, more local authorities, and to be honest with you, the UK is trying. There's much work to be done. Local authorities are trying because, it's not, yeah, health inequalities can come in different ways, it can appear in different ways, especially children and young people, adults, elderly. It occurs in different ways. And the same way, local authorities are trying to address health inequalities, also the same way they need to pay salaries, they need to keep, the refuse, ensure that roads are being kept well, public utilities are kept. So there's a lot of demand on funding really across the UK, and that's a big problem. So, but I know that local authorities are trying. But the first thing to tackling health inequality is to recognize the inequalities. And you can only recognize the inequalities by being embedded in the community. So we need a lot of local authorities to be embedded in the communities they serve, so that way you can get the feedback, get like a do. We do statutory as a local authority. We do what we call the joint strategic needs assessment. And usually what that means is that
Okay.
you take different topic areas across health and you do a needs assessment. Needs assessment means you're trying to find out what exactly are the concerns, what are the needs, what's the data around. And without that, that forms like the evidence to be able to go to do any intervention in that local authority. So I think a lot of local authorities need to do more with engaging with the communities that they serve, so that they can recognize the inequalities and give the appropriate measures, and interventions that will tackle it and reduce it, and ensure that there's access to healthcare. Because I feel one of the things, even in my previous role, was access. A lot of people, when we talk about access, they just think, is it just going to the hospital? Some people are not aware of so many services that are provided. So they need to be, so it's a matter of health
Yeah.
education. Do they know? And even if they know, do they have the right information that is well understood? For some people, especially with,
Yeah.
recent influx of, people from other countries in the country, there's a need to ensure that whatever health information is going out is understood. And it's not only, yeah,
By them.
I remember in my previous role, there was something we discovered, one insight we discovered. A lot of times, when we talk about accessibility of language accessibility, the government, local and national government always thinks just translates into their languages. But really, one of the things inside we found, where in fact myself and my manager, my previous manager, were trying to see if we can publish this insight, is the fact that quite a number of people are not even literate in their own languages. So even if you translate from English to their language, they still can't read it because they're not even literate. They only speak their languages. They don't even write it. So there's a lot of move now into visual representation. So a lot of pictures, things people can relate to help them understand, the information you're releasing out. So that's one of the things I really would advocate is try to make whatever information to be accessible, embed in the community to understand the kinds of health inequalities that exist so you can know the right measure of intervention and policies that can be given and also support that can be given for those inequalities. That's how to really tackle inequalities.
I think this explanation has just sort of changed my understanding of healthcare access, really. Because, like you said, people just think, oh, it's just okay. Can we get to the hospital and we've
Yeah,
gotten there? That's like what we'll probably think that's
yeah,
healthcare access, but there's actually a lot of
yeah.
layers behind getting to
Mm-hmm.
the hospital. Wow, thank you for that. So one of your interest areas is around workforce
Yes, yeah.
development, right? And so my question now is probably what kind of shifts do you think we sort of need in public health around maybe public health education or training?
Can you break down this question? Because this question is quite very big. It's very big because workforce development is it's,
So,
it's a big deal. If you can break it down, I'll be able to. Yes.
so I'm looking at it from the perspective of like maybe upskilling people who sort of work in public
Okay.
health space. Just like maybe we're talking about, okay, NHS is focused on digital. How do we
Yeah.
upskill people to get digital
Yeah. Yeah.
transformation and all of that? So looking at what's happening in the public health space in terms
Mhm.
of workforce, I mean, what do we sort of need to bring people up to speed to allow them function at the level
Yeah.
they ought to
Yeah.
function, really. Especially I'm now looking at people who are
Yeah.
new in the system or trying
Yeah.
to break
Hmm.
into that space. How best do you think we can support those people in terms of
Yeah, to
developing
be
them?
honest with you, there are quite a number of support available because we have different bodies. The main body or the main governing body for public health in the UK is the Faculty of Public Health. Now, there's also some other association like the
Okay.
Royal Society for Public Health. There is the Association of Director of Public Health. There are quite a number of public health organizations, but the main governing body is the Faculty of Public Health, and they have quite a number of support available for workforce development. So there are opportunities for continuous CPDs, continuous professional development. There are opportunities for webinars for. So really, what one of the things is, and they have across the entire country, regionally. So like the southeast region, the northeast, the Yorkshire and Umber, they have different workforce, teams that helps to recognize what are the
Yeah.
things, what are the issues in public health, where's the direction we want to go to, and what do we need to ensure that everyone that is working in the public health space can gain the skills. And that ties back to
Yeah.
why I said
Okay.
you necessarily don't need to do courses because you have opportunities to learn and get better on the job. Because each of those
Hmm.
different regions, they have all the different priorities with regard to workforce development. So because even while I was in the Northeast, before I came to the Southeast, every month
Yeah.
we have different emails would tell us what are the different webinars available, what are the different seminars available, what are the workshops available that we can sign up. So usually it's one thing for them to have organized everything. It's also for you to see them and say, oh, which one applies to me? Which ones can I go for because they apply to the work that I'm doing. And also for you to think ahead of, just now and say, where I want to get to, which ones do I need to start going to so that I can get those skills necessary for that. So
Yeah.
it still also boils down to you doing a lot of self-development, being self-motivated, and charting your course. I recognize that there's not a lot of mentors in the public health space. I'm not gonna lie. That's one of the truth. No, it's the honest truth. There are not a lot of people to mentor. I know recently we're seeing, the Faculty of Public Health and quite a number of people being very intentional about, you know, mentorship, but
Yeah.
they don't. So for to a very large extent, you just have to be self-motivated, self-learning. Look out for all the opportunities because they are actually opportunities for development. But you need to now sign up for them and
Hmm.
keep, monitor your progress and chart a way for you to move forward, really. it's still left to you eventually. But there are opportunities around across the country.
So just rounding up, I mean, we spent some time having this interesting conversation. So what advice would you give to someone who wants to move from clinical to your kind of role in public
In
health or
general,
public health in
I
general?
think, yeah, because I
Yeah.
put something up on my LinkedIn a couple of weeks ago, and I said the first thing is for you to take stock of where you are. And taking stock of where you are, you know what I have and what I don't have. Now, also recognizing the fact that you need to see, because you want to enter into public health space, you need to look at the current skills you have in the lens of public health. So that means you need to recognize those transferable skills, like, those things that you would maybe, if you're not paying attention, you might dismiss them as irrelevant skills. But you need to now look at them from that public health space. That how does this really apply in public health, so that you can recognize it and you can hold them very much and showcase them really moving on. Now you need to be very audacious, because you will get, maybe some other people would apply for one role and get it, maybe. But for a lot of people, you would have to keep applying and keep applying, learning from the previous applications you've had, the previous no's, to be able to get to that place you desire. And I always will tell people, you just need one yes. One yes is what you need to get a foot in the door. So don't be discouraged, because you would
Yeah.
get a couple of no's, a number of no's, a lot of no's. And that's the honest truth.
I
You
got a
will
lot
get a
of
lot of
no's
no's.
anyway.
And that's because, it's just the way it is, because you're moving from, especially I know a lot of IMGs, medical graduates, and you're transitioning from clinic. So you're doing two transitioning. You're transitioning from clinic to public health. You're also transitioning from another country to another country. So the barriers where you have to really surmount is quite a lot. It's not simple. So be patient with yourself. Be audacious. And when I mean audacious means, even if you had no's, keep going at it. Don't stop. You just need one yes. And also be patient with yourself, that it might not come in 1 month, 2 months, 3 months, but eventually it would. So you just need to be patient with yourself, be audacious, and have a goal, set the goal, and work towards it from where you are, where you want to get to. If you can, reach out to people and try to learn what they've done, how they've gone about their journeys. Because I think for me, that's been one of the greatest gifts I've gotten. Apart from it, like I said, having a supportive manager, it's also the fact that I had mentors, people I could speak to while I
Yeah.
was doing my master. So that way, I covered ground in a short time. I just rode on the backs of people that have gone ahead of me, so that they could teach me and they could show me the ropes and show me the way. And really, it helped out. So those are things that I feel would really help you to make the transition from clinical medicine to public health, or from one country to another country, really.
So looking at your work in
Okay.
public health now, so if I was a doctor who was or
Okay.
healthcare worker who was very unsure about coming into public health, what would you tell me?
I say first things first, be sure you have to make up your mind.
Yeah.
Because if you don't make up your mind and you
Mm,
face some level of opposition, you will throw in the towel, because you like, I didn't know this is like this, so it's like. But because if you make up your mind, even if the adversity or whatever rejections you get come at you, you're already prepared yourself for the journey. So I would say be prepared, make up your mind that this is what you want to go through, and follow through. And like I said previously, public health is very wide. It's a one of the widest. There's always a place for you, but you just need to be able to maneuver. And just this, before I forget, is there are different roles in public health. So you must not be at the initial stage. Don't be too fast to specialize. Don't be too fast. When I mean specialize, I mean don't be too
yeah.
fast to be in one route in public health, especially when you're coming in. You need to learn, you need to get the breadth and length of all the skills and competencies. Be very open minded to enter. So you might come in through a public health administrative role, you might come in through a public health support role, you might come in through any entry level public. But once you have your eyes on the goal, the focus, you are very focused. Eventually, you'll find the opportunities in this, and you can upskill and go into the public health core public health practitioner officer roles. So don't be too close-minded and to be too look at those low-hanging fruits, the admin roles, the support roles, the project officer roles, the program officer roles in public health, and go through them. pick them up, do them, because all the skills you need in core public health are skills you also would need there. So from there, you can upskill, you can really advance in your career into the core, what you call the core public health, strategic roles.
All right. I guess anybody watching who is a junior doctor, I mean, you've heard it from him. So let me check if there's any question on the chat. So I have somebody who's got a question. He's saying, my question is it better to go through residency in public health to have some kind of structure in one's trajectory in
So
public
that's a
health?
different conversation entirely. But I would say this because going into specialty training in public
Yeah.
health is a different conversation. It's totally different from the only reason you
Wow.
go through
Okay.
that is because you want to become a consultant in public health. That's the only way you can become okay. That's the one of the two ways you can become a consultant in public health in the UK. But you don't
Okay.
have to be a consultant to work in public health. So going through specialty training or doing a portfolio route to becoming a consultant opens up two major roles: consultant in public health and becoming a director of public health. Those are the two roles that having those two pathways getting into. But
Okay.
every other role in public health in the United Kingdom does not need you to go in through specialty training, what we call residency in Nigeria. You don't have to go through them.
Training.
And there's specialty training in public health is quite very different because it's not only doctors that go through it. Even non-medics have a pathway to going through specialty
Yeah.
training.
Do that.
So, but you can really get to the heights of public health without being a consultant, by working in public health. There's an opportunity for you, to do that in public health in the UK.
Okay. I hope that answers your question, Abdul Mujib. Let me see if there's any other additional question in the chat. No, it says thank you for the answer. So I
Yeah,
guess that answers
yeah,
his question. In terms of mentorship, I mean, you talked about mentorship, how, I mean, we don't really have a lot of persons who mentor people in these areas, but you are sort of privileged to have people to sort of guide you. And I know mentorship actually
yes, it
shortens
does.
your journey. That one, as in, even it's my own experience, really. So are you open to mentoring people when people reach out to you on LinkedIn for issues, question, and all of that?
I'm always very careful. I'm always very careful when asked this question because what eventually happens is that there's always like a floodgate of requests on LinkedIn and your DMs are very full and all of that.
Yeah,
But like I said, I try my possible best to support people if I have to review quite a number of. Since last year, I've been reviewing people's supporting statements, going through applications with them, reviewing
yeah,
people's interview. Because, like I said, it's one this conversation we've had today is just very busy because there's a thing about understanding how to apply for public health roles, how to go for interviews for public health roles. It's a different thing entirely. So I try my possible best. I try to respond. I'm still very bad at it because I have my DMs full, but I try very much to really respond to people because I know how it is for people to gather, the courage to reach out to you. So I try my possible best. But I try to also go for seminars or workshops. There was one that was organized by a friend of mine, Adaeze, a couple of weeks back in Manchester, public health
okay.
at Public Health
In
Connect,
Manchester,
and
right?
I was opportune to be a panelist on that. And so I look out for opportunities like that to speak out at workshops just to help people. I try my possible best also on LinkedIn to do a lot of posts just to help people, so people can just see. Even if you cannot not reach out to me, personally, if I cannot respond to you, I have resources online. But I think one of the things, and yeah, just before I go, one of the things I did a couple of weeks, a month ago was I recognize the fact that a lot of people don't know the public health rules that are available. You understand? So I created a
Yeah.
Telegram job group, like a job board. So where any public health rule I see, because I can recognize the public health rule, even if they don't have public health in it, I know what the rules are. So I put it there. So that's one of the things I have. So I
Ah,
have like a job board on Telegram and quite a number. I think we're almost like 1,000 people on that group now. Just I put quite a lot of
wow.
any job opportunities I see, information, I just put it there.
Info.
At least I'm hoping in the next few months I get to skill it up and become more structured to it so that I can be able to help people, even if it's going to come at a cost, or better still, whatever it's going to be. I'm hoping that in the next couple of months I'm able to put a structure to helping people, especially with applications, interviews, jobs, and all of that. So, but like I said, please, if you can, try your luck, slide into my DM. I promise to try to respond to you, but nevertheless, I have resources on LinkedIn, that you can always read through and see.
I think I'll probably get the
Okay.
Telegram channel link from you so that I can
Okay.
just pop it
Yeah.
in the description so that people who are on public health can also sort of join that. So I've got another question. It says, how do you keep up the momentum, especially balancing family, moving across regions, and all of that?
I think one of the things that I would lay claim to you being a Nigerian first as one of my superpowers because as a Nigerian, we've been through a lot. So there's nothing I don't think I can go through, that I cannot be able to withstand. Because really, I moved to my new job so I just started my new role in Southampton. And during the same period, I had
Yeah.
twins. During the same period, I also had to move from
Wow.
the north to the south. So it's just, I saw something on Twitter a couple of days ago. I said, nobody's coming to save you, so you don't pick yourself up. If you remember this Clark Kent Superman, somebody save me. Nobody's coming to save you. So you
Yeah.
better find save yourself.
You
So
have to save yourself.
so, but I think it's just, one of the things is you being a Nigerian. I would say being a Nigerian has taught me resilience because you just have to multitask and do everything to be able to, stay afloat. And also you being self-motivated, I'm a very self-motivated person because I want to see myself get to the very top of my career. So I will do whatever it takes to balance my entire
Yeah.
life. And I have a very supportive family. That's one thing I will never take for granted. I have my parents are amazing, my siblings are amazing, my friends, my close circle of friends are people that I can call up. Even in this UK, as much as people say, oh, everybody's busy, these are people that I will call up to go and help me sort things out at home when I'm not around. And they would do it without. So like I said, I recognize my privilege. I really recognize my privilege. So those are things that those are things that I have that is able to make me to fly high. So, yeah, that's it really.
Abdul Mujib, I hope that sort of answers your question around keeping the family and all the whole stress balanced at the same time. I totally agree with you. It could be very Herculean, really, trying to, juggle all of these things at the same time, balance at the same time. I remember when
Mm-hmm.
I also sort of moved. I think I moved from Wales to Peru, and doing two jobs, it was just like absolute chaos. But
Mm-hmm.
somehow, like
Yeah.
you said, you just have to figure it
Nobody's
out.
coming to
Nobody's
save
coming
you.
to
So
save
you
you.
have to just find that next drive, just toughen yourself up and, keep at it. Because eventually, I was speaking to a friend and I said, the thing about life is, and this doesn't just even apply to public health alone, it's just life, is the struggles you're facing now, once you get into the place of rest and, of reward, all of those struggles, it disappears because you're in a place where you can enjoy the fruit of your labor.
Yeah,
So when the time when you have to put in the work, nobody sees it really. Nobody appreciates the toiling, the traveling. Is the
the
result we all
results we
look at,
see.
and also the result. As much as it appeals to people, it also gives you that reassurance and that um, it gives you that satisfaction when you see that the work, the things you've done, really, they've yielded results. So that's enough motivation. Actually, should be enough motivation to help you through.
All right, thank you so much. I mean, I still have questions, but
Yeah.
we're way behind the regular time slot for this. So thank you so much for coming on. If you've been watching, that was Dr. Clifford Enobun, sharing his experience, his journey from clinical in Nigeria to public health in the UK. And for me, I mean, I'm really inspired, and I hope you are, because his clarity, his conviction, his commitment, everything just shows, and seeing the fruits of his labor. So if you enjoyed today's episode, please share it with a colleague, with a friend who needs to hear this, particularly very much interested in public health. I mean, to be fair, most of the lessons he's shared is very applicable to whatever space you're trying to pivot into, maybe health tech, project management, business analysis, wherever it is. Key for me is things around, I think most importantly, self motivation. Like you said, nobody is coming to save you. You just have to drive yourself to that, destination where you're heading to. And don't forget to subscribe. I usually don't say this in the beginning, but please don't forget to subscribe to the channel. Leave us a review so that YouTube can keep sharing this video. And until next time, we'll keep exploring these spaces where passion meets purpose and impact. Until next episode, I'll see you guys. Cheers and bye for now. Stop.